Hi everyone, this is Dr. David Wong, one of the periodontists here at Route 66 Dental Implants and Periodontics. Today what I wanted to do is to do a small little demonstration with our PIEZOSURGERY unit. And as you can see here, the way we set up this experiment is on a raw egg. And on the raw egg we've used a pencil and we've drawn a circle onto the egg. And the goal of this with our PIEZOSURGERY unit is we're not only outlining and tracing that pencil mark, but what we're going to be doing with this is we're actually going to remove the shell from inside that circle. And if you guys are familiar with eggs at all, what you're going to remember is that underneath that shell is going to be a thin membrane that protects the yolk and all the egg white inside. Well, why are we doing this experiment? Well, if you're considering surgery just such as dental implants or periodontal surgery or gum grafts or things of that nature, one of the things that patients are often concerned about, and to be honest, doctors are as well, is hitting vital structures or important structures such as nerves and blood vessels, sinus cavities, and things like that. Well, under normal circumstances, most surgeons will use just traditional scalpel blades and surgical instruments. Here at Route 66 Dental Implants and Periodontics, we've taken that safety and technology a little step further by using our PIEZOSURGERY unit. And what is the PIEZOSURGERY unit? Well, what it is it's basically a surgical machine that makes very precise incisions using vibration movements. So rather than cutting or drilling, what you're seeing here and witnessing on the video on this egg is that this round tip, which is perfectly blunt, not sharp at all, what it's doing is it's vibrating at very high rates, and by doing so, it's literally removing the shell of that egg. The cool thing about it is once it contacts things like nerves and blood vessels, and in this situation, the membrane of the egg, it actually will not tear the membrane no matter how thin it is. Of course, as a patient, you can see how beneficial this would be. Not only does it increase the safety of your surgery, but it also improves the precision for the surgeon. So as we're going through here, what you're seeing is we're slowly removing that bit of eggshell in that circular fashion that we outlined with our pencil. As we're zooming in and out, you're going to be able to see that membrane. That right there is the membrane of the egg that you're seeing. And what it allows us to do that traditional dental drills and that nature do not do is that we have additional tips such as this one here where we can actually cut sideways. And as we're doing this, you can literally see how gentle this machine is at lifting the eggshell from the underlying membrane without tearing the membrane. For those of you guys who have had this used on you, you'll notice that it reduces bruising and swelling. Your post-operative discomfort is quite a bit different than if you did it the traditional route. Once again, we mentioned the safety concerns, and here we are. We've got the membrane exposed with the shell lifted off. We can turn the egg upside down. None of the yolk or egg white or any of the contents inside the egg is coming out whatsoever. Very safe. So if you guys ever considered having dental implant surgery or periodontal surgery anywhere in or around Tulsa, I hope you'd consider Route 66 Dental Implants and Periodontics. As you can see here, a similar surgery performed on a different egg utilizing the traditional drill predictably results in just a big hole being drilled through the egg and losing all of its contents, whereas the egg on the left was performed with the PIEZOSURGERY unit. So anyway, if you're in Tulsa, come check us out.